Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCPLive. In today's episode, we are featuring Dr. Nicole Negbenebor, a board-certified dermatologist and active member of the Skin of Color Society, also known as SOCS. Welcome, Dr. Negbenebor. Please tell us a little bit about yourself.
Thank you so much for having me today. This is
Of
awesome.
course.
I love Skin Color Society and everything that this organization has been doing in dermatology. And, just about myself. So I'm originally from North Carolina and I went to Brown for my dermatology residency. And then I went to University of Iowa for my Mohs fellowship, where I learned about cutaneous oncology and Mohs surgery. And I have been having a great time. Honestly, I was, drawn to dermatology for, a myriad of different reasons. And, some of those include increasing advocacy for bringing dermatology to people of all different communities, as well as treating skin cancer and autoimmune disease such as hidradenitis suppurativa. And I just really love what this specialty has to bring for people who have very diverse and varied interests.
Absolutely, absolutely. And I feel like you're on the right podcast to talk about those topics, so that's good to hear. Well, yeah, I wanted to ask you a little bit about exactly what you were just mentioning, which is what drew you into this specialty. So, where has kind of your research and your clinical interest, where have they taken you? And yeah, what did draw you to the specialty, kind of more specifically?
Yeah, it was hard because during medical school, I was like, oh my gosh, I think I like everything. What has everything? I mean, for a while, I thought I was going to be a pediatrician. And then I was like, oh, well, neurosurgery is cool. And then, I rotated during medical school in dermatology, and the people just seemed so down to earth, so kind. People were very intellectual, academic. They loved reading papers and then talking about them, discussing it. And there was just so much that we didn't know, and I liked that aspect of it. It hadn't been all figured out. And the skin is really kind of the iceberg of what's going on in people's bodies sometimes. So we may see some changes on the skin, but then that may tell us, oh, maybe they have, hyperglycemia, or maybe they are undergoing, chemotherapy. There's so many different things that the skin can tell us as a window. And I liked that investigational aspect of dermatology. And now that I'm in dermatology, it's even better than I thought because, there's so many different conditions that you don't learn about as a medical student. And you don't really fully appreciate the fact that you can do pathology, you can also do surgery, you're seeing kids, you're seeing adults. So it did have that wide expanse of different fields within one kind of field. And I think if you're somebody who really likes to have different interests and you never really want to get bored, you won't really get bored in dermatology.
Well, I wanted to ask you then about your role specifically as director of the Skin of Color Clinic at the University of Iowa. So, what cases do you see, and what are some of the important advances in these practice areas that you're seeing?
Yeah. Yeah. So I let me back up. So one of my mentors is Dr. Ferguson, and she started the Skin Color Clinic at the University of Iowa. And after she left, I picked up the Skin Color Clinic again, and I have absolutely loved it because there are so many instances where I have met patients who were really looking for their space in dermatology and felt like they weren't being represented or heard. And having a space where they can come and talk about their different hair concerns, different concerns with post-inflammatory hyperpigmentation, or how things are showing up on their skin tone, what's best for their skin tone. That has been a space that's been created now at the University of Iowa, where patients do feel that they're being listened to, that they have different kind of conditions where, it's not only that they're going to be judged in a certain way for having those conditions, and then also understanding different nuances between cultural practices, such as how often to wash your hair texture, all kind of things that maybe sometimes we don't always think about or always taught in residency. And some of the conditions that we treat, it really spans from vitiligo to hidradenitis to different types of alopecia, scarring alopecias. There's, acne culoidalis, nuque. We also treat not only medically, but also cosmetically. So what lasers are safe in skin color, we kind of do that, as well as making sure that we're working with patients to meet them where they are in dermatology to be treated as well. And there's a large educational component to it too, because residents also rotate through the skin color clinic. So they're learning about different ways to treat people with skin of color that maybe they had never been exposed to before. Like maybe somebody doesn't want to use ketoconazole shampoo because it could be drying to their hair and then is now leading to hair breakage. But then the main complaint is, hair breakage. So maybe mixing that in with other things or more moisturizing shampoos, all kinds of other things. I'm just using this as an example, but there are different ways where it's not always going off the same script for everybody to be treated the same way medically. Maybe we can also meet people where they are and also kind of integrate some of the medical practices that we have to help better improve people more effectively.
Yeah, absolutely. And that's, one of the topics we obviously cover a lot on this podcast here. And I'm curious about your take on this too, because you've overseen a lot at that particular clinic. Do you see sort of the ways that people are practicing these kinds of measures and the way that they're counseling patients? Do you see those changing and evolving with the times, or do you feel like we have a long way to go? What is your kind of take on what you've seen?
Yeah, I have definitely seen it improving. I have definitely seen it improving. We always have, somewhat of a long way to go, but, I have been very, very impressed in clinic with the way people are open to learning more about people's cultures and, trying to figure out how best can we treat the patient, with respect to their quality of life. I will say that we get a lot of patients who have been places, though, where they felt like they weren't being listened to, or sometimes we have patients who come in and they are pretty emotional, really, about their experience because they're like, this is the first time I felt comfortable in a doctor's office. And we want patients to feel that way. And, I think sometimes patients get a sense of peace and comfort knowing that, we're not judging them for maybe some of the things that they may mention about how often they're washing hair or other kind of conditions or things. Or maybe somebody, instead of using a certain soap, they want to use African black soap, So that's another education opportunity for not only the patient, but also us as physicians, because now we're learning about other things that maybe you can't, we wouldn't suggest you use this, but we would suggest you use this similar to the African black soap, or, African black soap would be fine. It's, so integrating that also into our toolbox, things that are outside of what are specifically just a prescription or just the things that we talk about in kind of conventional medicine too.
That's excellent. Yeah, thank you. Well, okay, so now I want to zoom out a little bit and just ask you, because you said that this was one of the fields that you were looking at when you first pursued medicine. I know you said you could go for a lot of different fields, though. You had a lot of varied interests. So, what would you say are the main rewards specifically about being a dermatologist? And then, alternatively, some of the greatest challenges?
Yeah, yeah. So one of the rewards of being a dermatologist is that everybody has skin. Every single person has skin. And, you really get to see the variation and how different conditions present on people, different skin. And, sometimes if this is the first sign of a disease, you can be the one to help diagnose that and get people in sooner, hopefully, before it's morbid or before it progresses. And, there's some people, there are a lot of people, walking around with, maybe inflammatory disease. And then all of a sudden, like, I have really bad arthritis. And then, oh, I'm really realizing that I'm having some nail changes with that. And then, oh, I'm noticing that I'm also having some patches on my skin, some plaques. Oh, maybe you have psoriasis. Have you thought about getting that checked out? All this kind of other stuff. And so, being a dermatologist, I think it's a real privilege because you get to help within the greater medical kind of establishment of helping to diagnose disease, hopefully, at the right time period. And then, you can also be a great kind of, consultant because a lot of patients are prescribed antibiotics. We see stuff like Stevens-Johnson syndrome, which can be life-threatening, but then for the majority of our time, we're mostly diagnosing people who have conditions that are not, leading to mortality or anything like that. So you get a great sense of satisfaction from being able to provide, treatments, effective treatments for people and really change their lives, particularly for acne, post-inflammatory hyperpigmentation, other conditions, hair loss. This is really affecting people's lives, and people are very grateful for when you can help them with that. Some of the challenges I would say is that I have a couple of, things I'm thinking, but I think the first one is that people assume that we just do cosmetics. That's really just one aspect of dermatology. I do like treating patients and helping with cosmetics, but we also, do the medical component. And I don't want people to forget that. We're here to, be physicians and, help people, with a lot of the medical conditions that do relate to dermatology. And so, I think sometimes there's a public image of us, only, paying attention to the cosmetic part, but we do it all. We do it all. And that's, one of the exciting and interesting aspects of dermatology. And then, another challenge is that honestly, I wish I had more time. I just wish I had more time because there are so many people who need to get in to see dermatology. And we have sometimes, months and months where patients are waiting. And that's frustrating sometimes. So it's great, because obviously there are a lot of people who need our services. On the other hand, I wish people had more access to us.
Absolutely. Those are good answers. And I was going to say, speaking as a, journalist and content producer, I do find that I find it hard sometimes to explain to my family and friends what I do. And I was curious, do you find that you have to explain to people that you're not an esthetician? In fact, like to your family, for example?
Not so much explain that, but I do have to explain the difference.
That's, yeah.
And,
Yeah.
you know, I think it's very confusing. I think it's very confusing because people, especially when more and more people used to wear the white coat, they just see somebody wearing a white coat and they automatically assume. And more people are wearing scrubs now, so I don't think that's much of an issue. But I think in terms of credentialing and experience, people are just very confused about who does what. And as dermatologists, we do have the opportunity to be the leaders of some of these conversations, about what is appropriate or what is effective. And I think people still, even though there's all that information out there, they still come to us asking about our opinions and what we would suggest for some of the most effective treatments. So I think that's good.
Yeah, definitely. Well, I want to move on now to ask you about an example that you might have of an especially challenging or complex patient case that you navigated, and specifically one that ended up being rewarding. So, what would you say? Do you have an example of that?
Yes. So I have a couple of patient cases like that, but one of them was this patient, very sweet lady, and she was here in this country by herself, and she had just had a little baby who was like within I think 1 month old, and she had an enlarging dermatofibroma sarcoma protuberans, so DFSP on her face. And, I think people sometimes talk about skin cancer, particularly in patients of color. And, as a Mohs surgeon, I do see it. And as a Mohs surgeon in Iowa, I see it. And, I think there's this kind of myth that people of color don't get skin cancer, but it happens and it occurs. And she had had surgery to take it out, and it was not taken out with clear margins. And then it was never taken out after that and just kept growing. So then she came to us for Mohs, and this may have been a case in some places where that may have been palliative instead of actually doing surgery because of how large it was. But we coordinated with um, our ENT counterparts, and we were able to clear her from, clear the Mohs area. And it's pretty extensive, deep within her cheek. And then they repaired her with a split thickness skin graft in a flap. And she's been doing well. She went back to work, working in a factory. And then, we had to organize childcare for her, and so that was a challenging case because not only were we dealing with this large skin cancer that had high morbidity, in this patient, and that does have a high recurrence risk potentially. But we also had to kind of deal with, navigating. She didn't speak English, so we had to work with a French interpreter, like, and as you're having surgery, it's already complicated. But then to now, add in the fact that, you need interpreter services and understanding the process. And then we also had to navigate childcare for her child because there's nobody else in this country to help take care of her child. And she was going to be admitted to the hospital for several days. And so there were medical aspects, surgical aspects, and then also, social aspects where we had to make sure that we were doing the best for the patient.
In your career, you've done a lot of research and writing. I was being told that you have a lot of writing experience and that you're a very good writer before we
Oh,
started
thank you.
recording this podcast. So please tell us a little bit more about what captures your interest and kind of inspires you and any knowledge gaps you're working to fill.
Oh, yeah. Yeah. I love writing. I do. And, I really started in high school, but, I had this teacher and he was like, don't ever stop writing. Sometimes we get busy and, we don't have the chance to do the things that we enjoy, but don't stop, doing this. And then I just remember his words and there were time periods where, you're studying and it's just work is so crazy, but writing is like my outlet. It's like the way to help me reflect on the things that I've seen and the things that are going on, and in a way to also be an advocate for some of the things that we're seeing. So if I have a patient and I'm fighting with insurance to get them covered for a biologic, we can go and write about it. We can go and put this in publication and hopefully get more support so that people can put this patient's story, not the specifics of their story, but, in general, advocate for the patients to get, the medications that they need without all of these barriers. And I think putting something in print not only makes it a little bit more actionable, but also makes it so that it's kind of recorded in history, the events that happened and then the actions that we had to go along with those events. And I've just loved, being able to tell other people's stories and tell my own story through writing. I think it's very cathartic in some ways. And that we see so many stories in medicine. We see so many stories, similar to what you're doing, honestly. You're telling a story. But also, we're relaying other people's words to kind of craft how, at least for me, advocacy and, well, yeah, yeah. I was just thinking, the kind of medical kind of drudge of, going to work and then trying to put together some of the challenges that we have, into words, and also some of the triumphs that we have into words, because not everybody's privy to that. How do you, put that into an article that people can kind of read and take, at least some kind of information that they're going to go back and use in their lives? That's what I have found writing to be, that kind of avenue for myself.
Let's talk about the role of collaboration with your colleagues outside of dermatology. What kinds of other specialists do you consult with on behalf of your patients, and do you have any big takeaways from those exchanges?
Yeah, yeah. So, every week, several times a week, here at this institution, we have tumor boards and we collaborate with hematologists, oncologists, radiation oncologists, general surgeons, surgical oncologists, ENT surgeons, I think I already said radiologist, but we kind of work with a primary care, OB-GYN, depending on the tumor board, but we really work with a wide range of different specialties. And I think it's been great to do that because people are trained within their specialties to do what they are experts at doing. And there's only a certain kind of level in which your job starts and stops. And so that's when somebody else can take over and we can work together to kind of give the patient the best medical care. There have been cases where, I mentioned the one about the skin cancer on her cheek, but there have been other cases where, for example, I had a patient and she had a large skin cancer, not only involving the thigh, but also extending onto her vulvar area. She tolerated, the Mohs surgery completely during it, but for repair, I think she was going to need a lot more numbing. She's going to need a lot more pain control. So we coordinated with our plastic surgery counterparts, and they were fantastic. And she did very well. And initially, she was a little bit concerned about going under general anesthesia and not waking up because she had not been to a doctor in 20 years. And so all of a sudden, it's like, I'm seeing dermatology, I'm seeing Mohs, I'm seeing plastic surgery, like I'm seeing anesthesia, but we needed not only the Mohs team and the plastic surgery team, but also the anesthesia team to kind of come together and then make sure that we cleared her cancer for her, after she had it for, growing, honestly, for so many years. And I'm somebody who's always loved team sports. Soccer is one of my favorite sports. And I see medicine in some ways as this team sport, working on behalf of the patient. And I think it's fantastic.
What would you like colleagues in other specialties to better understand about the dermatologist perspective, specifically on the health and well-being of the whole patient?
Mm. I think one of the things is that we are there to kind of help not only educate the patient, but also other teams on what's going on. I think sometimes it can be intimidating when people see a skin condition and they feel like they do not have the education to kind of diagnose it. And so sometimes it, like, maybe they'll wait or delay to call or consult dermatology, or like maybe they'll say like, oh, it's nothing, until it becomes something. And maybe that something was, you know, truly showing up on the skin first, but then now we can see it as the labs change, or now we can see it because they're having some other condition. So I think relying on your dermatology friends and actually, like having more conversations, I think would be helpful. Hidradenitis suppurativa is a condition that is often diagnosed late, unfortunately. And some of these patients have been seen by their primary care doctors, they've been seen by OB-GYN, they've been seen by urologist, and it was just kind of diagnosed as boils or folliculitis or a cyst. And sometimes I have been sent patients not because they had a diagnosis of hidradenitis suppurativa, but because they had a cyst and they wanted me to cut out the cyst. And it's not until I meet that patient, I'm like, oh, are you getting these recurrent cysts, in these specific places? And oh, and you're getting scarring with it. Oh, and you're getting tunneling with it. And I wish for that patient sometimes that they could get access to dermatology sooner. So that's why I'm saying maybe working with dermatology for some changes of the skin that patients report, in working with us sooner, I think would be helpful.
Okay, now I want to ask you a little bit about your experiences with the Skin of Color Society. So what would you say you've gained by working with SOCS?
So much, because when I was a medical student, I did the Skin of Color Society mentorship program, and Dr. Okoye was one of my mentors. Also, Dr. McMichael was one of my mentors. And it was just a great way to be honestly integrated into the dermatology society, because there's American Academy of Dermatology, which is our large conference, and it can be overwhelming, going there and seeing so many people. Skin Color Society, it's almost like a family. It's almost like a way of coming into dermatology and feeling like you belong. And I would definitely encourage any medical student, resident, or other dermatologists to become a part of the Skin of Color Society if you feel like you would benefit from it, because you really get to know people and you really get to have lectures, particularly at the conference, lectures and other information that specifically focuses on treating patients of color. And sometimes you have to really sift through other kind of places, like information, to find that kind of information. And that's highly valuable information that honestly should be at the forefront. And I think the Skin of Color Society does a great job of highlighting it.
Well, I'd love to now close this podcast because we're coming to the end here with your favorite pearl of wisdom to inspire your colleagues. So please feel free to share a thought that's sort of been meaningful to you in your journey as a dermatologist.
But one of the things that I was thinking was, particularly for people who are applying to dermatology, I would say do not accept no for an answer. There are times where you can feel like, oh, I don't really have anything to offer, or like maybe you're feeling like it's a super competitive process to get into dermatology. That does not matter. You never know what the department is looking for. You never know if the residency program is looking for somebody just like you that brings your perspective and has some of these, experiences that you have. And, we're all different, we're all unique. And sometimes I think people hold themselves back before other people, hold you back. Make sure you find the right mentor. I think that's a huge thing because you do need somebody who can encourage you, especially in the setting of, feeling like your grades aren't good enough, your numbers aren't good enough, you don't have enough research. Still apply, still work to make sure that your application is strong and make sure that you find somebody who will vouch for you. Another thing too, personally, that, a pearl that I've had is, making sure that you're working more so for, a higher purpose than for men, like for, just other people, because I think it's very easy to get into a job and then feel like, man, I just want to make, I just want to make a lot of money, or I just want to, I don't know, I want to be able to get out at like 3 p.m. every day, or I don't know, which is great. You also want a life balance. But I think ultimately too, you did sign up for, treating people who really, really need us, a lot. And, there's a very unique training that you go through as a dermatologist that potentially could really change somebody's life. And I think, just never forgetting the fact that there are people who need us out there who are waiting for us, literally waiting for months to come to see us, and, this is our one chance to kind of capture them and, particularly make a positive improvement on their life. So, making sure that you're always kind of doing it for, the greater good.
Absolutely. And that's a great point to end on. So thank you so much, Dr. Negbenebor. We really appreciate you taking the time to speak with us today.
Thank you. Thank you so much.
Absolutely. And yeah, to our listeners, we hope you found today's episode enlightening as always. And if you're interested in learning more about the work of the Skin of Color Society, make sure you visit skinofcolorsociety.org. And don't forget to subscribe to HCPLive's newsletters, follow us on social media, and stay up to date on the latest in dermatology and more. And we'll be back with another episode very soon. So be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. And until next time, take care and thank you for listening.